Iron deficiency in women is more common than you might think, and often goes unnoticed. Despite being silent, its symptoms can quietly impact your energy, mood, and overall health. From persistent fatigue to unexplained dizziness, these subtle signs are easy to ignore but shouldn't be overlooked. In this video, we'll uncover the hidden symptoms of iron deficiency in women and explain why early detection is key to staying healthy and energized. Today, we'll talk about iron deficiency in women, silent symptoms you shouldn't ignore. So before we start, make sure to hit the like button and subscribe to my channel. 1. Introduction to iron deficiency and its importance. Iron deficiency is a widespread yet often overlooked nutritional problem affecting millions of women worldwide. Iron plays a critical role in producing hemoglobin, the protein in red blood cells responsible for transporting oxygen throughout the body. Without sufficient iron, the body struggles to create enough healthy red blood cells, leading to iron deficiency anemia, IDA. Women are particularly vulnerable to iron deficiency due to menstruation, pregnancy, and dietary habits. Despite its prevalence, many women remain unaware of their deficiency until it progresses to more severe stages. The early stages of iron deficiency often present with subtle or silent symptoms that can easily be dismissed or mistaken for stress or fatigue. Understanding the silent symptoms of iron deficiency is essential because untreated anemia can lead to serious health complications, including impaired cognitive function, reduced immunity, and complications during pregnancy. Raising awareness can help women seek timely diagnosis and treatment, improving overall health and quality of life. 2. Why women are more susceptible to iron deficiency. Women face unique physiological and lifestyle factors that increase their risk of iron deficiency. Menstrual bleeding is the primary cause, as regular monthly blood loss depletes iron stores over time. Heavy or prolonged periods, known as menorrhagia, amplify this risk considerably. Additionally, pregnancy significantly raises iron requirements to support fetal development and increased blood volume. If these needs are not met, iron deficiency and anemia can develop, leading to fatigue, poor pregnancy outcomes, and postpartum complications. Women who follow vegetarian or vegan diets may also have a higher risk because plant-based iron sources, non-heme iron, are less readily absorbed by the body than iron from animal products, heme iron. Other risk factors include frequent blood donation, gastrointestinal disorders that impair absorption, and chronic illnesses. Understanding these risk factors is crucial for early identification and prevention of iron deficiency in women. 3. Early silent symptoms you should watch for. Iron deficiency often begins silently, with symptoms so mild or nonspecific that they are easy to overlook. One of the earliest signs is unusual fatigue or lack of energy, which many women attribute to busy schedules or stress. However, this persistent exhaustion is a red flag that the body's tissues are not receiving enough oxygen due to insufficient hemoglobin. Another subtle symptom is pale skin, especially noticeable in the inner eyelids or fingernail beds. Women may also experience headaches or dizziness, resulting from reduced oxygen delivery to the brain. Restless leg syndrome, RLS, a condition characterized by uncomfortable leg sensations and an urge to move the legs, is also linked to iron deficiency. Additionally, iron deficiency can impair concentration and memory, sometimes referred to as brain fog. Early recognition of these symptoms is vital to prompt testing and intervention before anemia worsens. 4. Advanced symptoms and complications. If iron deficiency remains untreated, symptoms become more pronounced and debilitating. Women may develop shortness of breath during routine activities due to reduced oxygen carrying capacity. Heart palpitations or an irregular heartbeat can occur as the heart works harder to compensate for anemia. Cold hands and feet are common, reflecting poor blood circulation. A less known but significant symptom is brittle nails or spoon-shaped nails, koilonychia, which indicate long-standing iron deficiency. Cravings for non-food substances like ice, dirt, or starch, pica, may also develop. Beyond physical symptoms, severe iron deficiency can impact mental health, causing irritability, depression, or anxiety. In pregnant women, anemia increases the risk of preterm delivery, low birth weight, and maternal mortality. Understanding these complications highlights the importance of early diagnosis and consistent treatment. 5. Causes beyond menstruation and pregnancy. While menstruation and pregnancy are major contributors, other causes of iron deficiency in women warrant attention. Gastrointestinal bleeding, often due to ulcers, gastritis, or hemorrhoids can lead to chronic blood loss and depletion of iron stores. Disorders like celiac disease and inflammatory bowel disease (IBD) impair iron absorption in the intestines. Frequent blood donation without adequate iron replenishment can also result in deficiency. Additionally, certain medications, including proton pump inhibitors and antacids, interfere with iron absorption. Poor dietary intake, especially in women with restrictive eating habits or eating disorders, can be another major factor. 6. Diagnostic methods and importance of screening. Diagnosing iron deficiency requires a combination of clinical evaluation and laboratory tests. A thorough history and physical examination help identify symptoms and risk factors. Blood tests are essential to confirm iron deficiency and anemia. Common tests include a complete blood count, CBC, to check hemoglobin levels and red blood cell indices, serum ferritin to assess iron stores, serum iron, total iron binding capacity, TIBC, and transferrin saturation. Ferritin is the most sensitive indicator of iron deficiency, but can be elevated during inflammation, complicating diagnosis. 7. Treatment options and dietary recommendations. Treating iron deficiency primarily involves replenishing iron stores and addressing underlying causes. Oral iron supplements are the most common treatment and are effective if taken correctly, usually as ferrous sulfate, gluconate, or fumarate. It's important to take iron supplements on an empty stomach or with vitamin C-rich foods to enhance absorption, and avoid concurrent intake with calcium or certain medications that inhibit absorption. Intravenous iron therapy may be required for women who cannot tolerate oral supplements or have severe deficiency. Dietary improvements play a key role in prevention and treatment. Women should include iron-rich foods such as red meat, poultry, fish, legumes, dark leafy greens, and fortified cereals in their diet. Pairing these with vitamin C sources like citrus fruits improves iron uptake. Reducing intake of inhibitors like tea, coffee, and calcium-rich foods around mealtimes can also help. Lifestyle modifications and medical management together ensure successful recovery. 8. Prevention strategies and long-term health impact. Preventing iron deficiency in women involves a multi-pronged approach that includes dietary management, lifestyle changes, and regular health checkups. Women should be educated on the importance of a balanced diet with adequate iron intake and encouraged to monitor menstrual health. For those with heavy menstrual bleeding or chronic conditions, timely medical evaluation and treatment are critical. Pregnant women should receive prenatal care that includes iron supplementation and monitoring. Public health measures such as fortification of staple foods and community awareness programs play a significant role in reducing prevalence. Long-term untreated iron deficiency can impair immune function, reduce work capacity, and negatively affect mental health and cognitive development. By adopting preventive strategies, women can maintain optimal iron levels, improve overall health outcomes, and reduce the burden of iron deficiency anemia globally. If you like this video and would like to see more like it, please give it the thumbs up, leave a comment, and click the button to subscribe.